Well, good morning, everyone. My name is Dr. Della, also known as Dr. Della. I'm a naturopathic physician at Active Health and Wellness on Oak Bay Avenue in Victoria. Today I'll be talking about pain. So what pain is, why our bodies actually need pain, as well as how to treat it when it is not acting how it should. So what is pain? When defined by the International Association of the Study for Pain, it's widely known as an unpleasant sensory or emotional experience associated with actual or potential damage to tissue. Pain is very complex, and as you can tell from this definition, it's hard to define. Mental and physical pains are often hard to distinguish and associated with one another. Today, unfortunately, for the time constraints, I'm mostly talking about physical pain, but please, if you have any questions about the other sides of pain, ask me. Pain is advantageous. It gives us a signal that something is wrong. So if we need to withdraw from a burning flame, or we sprain our ankle and we need to prevent further damage to that tissue from standing on it or stepping on it. So in these cases, pain is useful. However, when an injured area is not acting how it should, when the pain is not subsiding, or if it's stuck in certain stages of healing, then sometimes that pain needs to be modulated. Pain gives us information, so we should not immediately think about suppressing it. We should pay attention to the story that it's trying to tell us so we can figure out what's going on, and then if that story requires, then we modulate it. How many of you have chronic pain? How many of you are in pain all of the time? So that's actually quite a bit less than the actual population that people put their hands up, but as I said today, about 50% of people are in chronic pain. So as a naturopathic physician or physician treating pain, you need to have a lot of different ways to treat your patients, as well as a complex plan of action, because every person that comes in for treatments responds differently to them. Nutrition is one of the best places to start for pain, both for the first step as well as for long-term management. A lot of people have nutritional deficiencies, a lot of people have difficulty absorbing nutrition, so there's a lot of things that can cause pain to be worse or actually cause it in the first place. A couple of things that I usually do is to help my patients have a low sugar and low inflammatory diet when they are experiencing chronic pain, or even when they have an acute injury. Ensuring patients are getting and absorbing their nutrients is also very important. This helps with tissue regeneration and repair, and also preventing pain from occurring in the first place. Decreasing sugar can seem like a very daunting task, but when cutting it out, it has a lot of downstream positive effects. It helps with cognitive function, it helps with inflammation in general, it helps prevent future injury from occurring, helps regulate blood sugar, which is probably one of the more obvious ones, as well as many, many other things. So processed sugars are in most foods that you would get packaged, and it's really good to start paying attention to this. To help and prevent lower inflammation, my last talk did a lot of information on that. It is posted on YouTube, so please review that if you want some more information. But inflammation is actually needed for healing. It's part of the normal healing process. So you don't actually want to prevent healing or stop inflammation from happening. You actually want to speed it up so it goes through the stages of inflammation quicker rather than stopping it altogether. So you prefer to modulate it. When people get stuck in different stages of inflammation, this is when a lot of things like chronic injuries occur, when you resprain or restrain or re-hurt yourself in different areas. So again, inflammation is important, but we just don't want to get stuck in certain stages. Some nutrients that can help to moderate or modulate inflammation and speed healing are a few things that I really like to use in my office, include things like proteases, frankincense, curcumin, and bromelain. I have some great combination products that have these in them. And for acute injuries, I like to use something called peptidases, which is actually an enzyme. But when you take it away from food, it helps the tissues to heal a lot quicker than it would actually otherwise. Another thing that's really important is protein. So anyone that has a decreased amount of protein or absorption of protein in their diets will have a hard time repairing and feel more pain as a result. One way to determine if you have enough protein in your diet is to test your ferritin or your iron levels and see. Another nutrient I believe that can impact a lot of people is magnesium. About 80% of the population is deficient in magnesium, both from absorption and consumption. So magnesium helps muscles to relax and can cause a lot of pain syndromes as a result. So when taking it, it helps with sleep, it helps with muscles, it helps with energy, so there's a lot of great benefits for taking magnesium. As well as working on things like absorption and making sure the digestive tract is working properly through taking out things that are irritating it and getting some things into the diet to help it function a little bit better. Sleep. Sleep is also very essential to repairing. How many of you get a consistent 8 hours of sleep before midnight each night? So starting before midnight. So 8 hours starting before midnight. So not a lot of us. Getting to bed before midnight is actually really important because each hour you get to bed afterwards, it takes more time for the body to regenerate than it would otherwise. So if you go to bed at 1 a.m. and you usually get 8 hours of sleep, now you need 9 hours of sleep to catch up. The circadian rhythms in your body require that you actually go to bed before that, otherwise it takes more time to get rested. And then a consistent hours of sleep is really important for that regeneration of tissue and repair of tissue as well. So if you're not getting a good sleep, you're going to be in more pain. Any ideas that you need for sleep? I have a sleep handout, and please feel free to email me or ask me about sleep because it's very, very important, as all you know. When you're on pain medication, your body can get adjusted to having that in the system over time. So when you're coming off pain medication or you want to decrease that medication, it's really important to implement other things first to make sure that you don't feel more pain afterwards. One of my favorite methods for tissue healing, I talked a little bit about this already because it's non-invasive, warming to the tissue, cost-effective, and works in over 90% of cases, which is very good for any treatment, is infrared lasers. The class 4 laser that I have has deeper penetrance and has a roller head, so you're actually able to get a little bit of myofascial massage at the same time. So I find it a really useful tool because I can do a lot of hands-on treatment with it and really figure out what's going on with the tissue as a result. The laser helps to modulate pain pathways, so prevents pain from occurring, helps to relax tissue, can help remove scar tissue and move it into more functional tissue, as well as do a slew of other things, including modulate the inflammation cascade and help with energy. A lot of people feel energy after their treatments as well. Another physical modality that I really like is acupuncture. Acupuncture is great as an overall tool to help with health maintenance as well as health promotion. And as a naturopathic doctor, I'm also trained in this. There are many ways that one can help moderate pain, improve healing, and prevent injury, but finding that specific balance for you is really what's important because, as I said, everyone responds differently to treatments. All right, so to end my presentation, I wanted you guys all to try a sugar challenge. Try to take out all processed sugars for 10 days from your diet so you can really appreciate how you feel with it, not in your system. Processed sugars are in most packaged or pre-made goods, so start reading ingredients and just really paying attention to how much sugar is in your diet. If you do eat quite a bit of sugar, then you will have a little bit of withdrawal the first couple of days that you're cutting it out. So I usually recommend doing that on a weekend or a time you don't need to be too productive, which all of you, I'm sure, is hard because you need to be productive, but the long-term effects of doing that after a few days, you'll really notice a difference. So try and do that if you can. So if any of you or a loved one are experiencing pain, please feel free to book in a 10-minute free consultation with me to discuss how I can help you or just some ideas to help you feel a little bit better. And please see all the handouts on the table about some other things going on, because no one should live in pain. Thank you, guys. And any questions?
We were talking earlier about magnesium and how our guys can be quite deficient. What is an indicator that you might be deficient, and what's the best way to get it into your system?
Yeah, a couple really common indicators are things like muscle cramps, muscle pains, energy are two things. If you have lower energy, magnesium can often be deficient as well. There are some ways you can test that through blood and other means as well. And to get that in, lots of greens, lots of mixed vegetables, as well as there's different forms of magnesium depending on what you need it for. I would come and ask me that individually because depending on what you need it for, there's some different forms that I recommend. And time for one more.